Welcome. My name is Sia. I am one of the executive committee members at Black Tides. Thank you for joining us. I hope that woke you up. This is a sequel to our data analytics careers space that happened in January, and we got cut off because Twitter was down that night of all nights. So decided to do a part two, and we have with us Odin and Auntie Kim, who is the co-founder of Black Tide. So what we'll do is we'll have them introduce themselves. We have a few questions, and then as they are speaking and you all get curious, you can request to speak, and we'll hear your questions as well. So, Odin, would you like to go ahead?
Sure. Thank you, Sia. Can you guys hear me fine?
Yes, we can.
Okay, cool. Hi, everyone. So my name is Odin Dunbar. I am a health informaticist based out of Orlando, Florida. I've been in this field now for about probably about 2.5 years. It was kind of a happy accident. I was actually a writing and rhetoric major back in college, and I was pursuing the digital marketing realm when I got a tip to explore this new field called informatics, and I did, and I fell in love with it and decided to pursue a master's degree in health informatics, and I worked at a health insurance company for about 2 years doing light informatics like duties, which include analyzing different type of healthcare related data, working with different cross-functional teams to help solve business problems. Recently, I switched to a more public health focus where I am responsible for doing the same thing, same informatics duties with the aggregation, storage, collection of public health data, but now we're more focused on building and developing a immunization information system. That way, we can better serve customers throughout the Washington state. So yeah, that's pretty much what I do on a day to day, and I'm looking forward to the conversations tonight.
Thank you, Odin. Auntie Kim, welcome.
Hi, everyone. I'm Kimberly Diaz, and I'm actually a chemical and health informaticist, which means I work across two broad areas of informatics, which is very challenging to say the least. But I was originally trained as a chemist and then went into pivoted into bioinformatics. So I did a lot of genomics and cancer genomics, things of that nature. And then from there, I decided I wanted to go in the healthcare space. Thanks to Lori, who's over Black Women in Technology. She was the first person to reach out to me and say, hey, you should think about a career in healthcare. So I started learning SQL. Actually, it was the first language that I learned. I had previously done some SAS at that point. The position that she had shared with me was actually at a healthcare center where I would have been required to learn Epic. And in retrospect, I wish I would have taken that position because being Epic certified in healthcare is extremely lucrative. And when I say lucrative, I mean $150,000 plus a year. But I digress. So I continue to take other programming classes, and I'm going to share a link in the Black Tides Twitter page of where you can see my specific path to where I got to today. Most of what I do now in informatics revolves around looking at outcomes. And so that's generally speaking what informaticians or informaticists do is they take data, they do some analyzation, they may do some visualization, and then ultimately they're trying to impact some specific outcome or they're looking at one particular outcome. So that's probably the biggest difference, say, between data analysts, health data analysts, health data scientists, and informaticists is that informaticists really are focused on outcomes. So that's a brief background about my career. Again, I'm going to post a link in the Black Ties Twitter chat, which will share a diagram that I created related to how I got to where I am today. And thanks everyone for joining.
Thank you. Hello, thank you. I was on mute saying thank you. Thank you. We're also joined by Andrea, who is our epidemiology lead at Black Tides, and she's also going to be speaking today. So please welcome and introduce yourself. We just got here.
Hello, I'm Andrea. I'm a health data scientist. I work at a Center for Federal Services. Basically, what I do day to day is develop different statistical models for clients and develop dashboards too. So it's a mixture of both. Some of my work is health equity focused, and I'm happy to be here and we're happy to answer any questions.
All right, thank you all. So the first thing we want to talk about, so last time when we were here, we kind of went across journeys. So how you got in, where you got in, and if you were to start again or get in right now, how would you do that? And what sort of background would you give yourself to position yourself to get into health analytics? And I will start with Kim.
Okay, so I'm going to actually answer this question with two paths. And the reason is because recently I've had a lot of people reach out to me who have clinical backgrounds. So whether they are a dietitian or a social worker or mostly nurses. My sister friend, who's a pharmacist, is actually looking to get into pharmacy informatics, which is another very lucrative, high opportunity field. So there's two different paths you can take to come into health data analytics or health informatics, at least in terms of the people who are mostly interested. So there are those people who have bachelor's degrees, say in biology or chemistry, I would fall in that category. And then there are those who actually have clinical training. So I would say if you're coming from a basic science background, the most important, well, I'm going to say two. So I would usually say SQL is the most important language that you need to learn because 90% of the data is contained in the SQL database, right? And it's probably more like 100%. I'm just not sure of the other. Well, actually, I do know that there's some NoSQL databases out there. So I'm talking about SQL databases. So when I mention a medical record system like Epic, the Epic tables are in a system called Caboodle, and Caboodle is SQL. So the path for a basic scientist or someone with a basic science degree, I think first master SQL and then also master Excel. That would be your first stop. And I'm going to continue about some other steps as we go along. And I'm sure some of the other speakers will mention them too. But I want to talk about the first step because that's kind of what gets you going. But if you're a clinician with no basic science background other than what you took, pre-med or whatever, I actually, in retrospect, think that you should start with a language called SPSS. One of the reasons is because it's extremely easy to learn. And without that basic science background, you may have a different way of thinking about things. That's why there are people who grow up to be scientists and others who grow up to be clinicians. So with a completely no programming experience whatsoever, no really advanced training in research methods testing and hypothesis testing as you may get, as a person with a bachelor's in chemistry or physics or something like that. If you are clinically trained, I would say start with SPSS. It's really, really super easy to learn. And then my second recommendation would be to then go to Excel, which you could actually do Excel and SPSS the same because you're working with spreadsheets in SPSS, and then go from there to SQL. So I'm going to stop right there with the beginning steps because I think that the first step is often the hardest for anyone in any endeavor. But again, if you're coming from a clinical background, start with SPSS and Excel, and then go to SQL. If you're starting from a non-clinical background, start with mastering Excel and SQL as a first step.
Thank you. So in general, just learn SQL, which is true, just in the baseline. Odin, would you like to add to that?
I think Kim kind of summed it up pretty well. What I will say is when I think back about how I started, one of the things that I wish I did was sort of like take a chance. I never thought about nursing or pharmacy or even med school because I just thought that was out of my realm. But as I progressed in my career, it's always been kind of, I wouldn't say a dark cloud, maybe a gray cloud, where I'm like, I wonder how much further I can propel in my career if I, had a clinical background. So I would say if you have the opportunity to where you can decide from, now whether or not, going the clinical or the nursing or the pharmacy route is for you, to do that for the sole purpose of picking your domain, right? Because healthcare is a very large space, so you have to pick, your specialty, because that helps you sort of like when it comes down to analytics, you'll have that subject matter expertise that will aid you when you're doing certain analysis. The other piece, so that covers the health side. In terms of the analytical side, I think that a lot of folks that are breaking or trying to break into these types of spaces focus a lot on the different types of tools, and they are ever changing. So my advice would be to um, learn the fundamentals of Excel and also SQL, because I think those two tools together will get you at least to a entry level, almost intermediate position in your field. And then from there, the rest is just, you know, it just depends on where what your employer is using. Like currently right now, I'm learning Databricks because that's what my employer is using now. But if I tried to learn Databricks, let's say 2 years ago, it would be for nothing really, because if my current employer isn't using a tool, all that knowledge is just gonna go dull and I have to sharpen it up again. So I would say don't get too bogged down into tools. In terms of analytics, Kim said SQL, you're going to need that to pull data out of a database, and then you're going to need something to analyze that. And Excel is just such a low-hanging fruit because it comes with the Microsoft suite of tools. And a lot of these softwares are expensive, and a lot of companies don't have the resources to invest in, let's say, SAS or Tableau. So it really makes it kind of challenging. And there's, let's say, Power BI. Power BI isn't Mac friendly, so there's a lot of walls that you hit. So I would say simplify it, Excel, SQL, and then you pick your domain specialty, and that's how I would start if I had to start over.
Hey, Sia, before you go on to the next speaker, Odin brought up something that I just want to interject real quick in here. He mentioned about domain expertise and about pursuing nursing or pharmacy or something to that nature. I'm going to 100% co-sign on that, right? I actually knew someone when I was actually working in cancer genomics at MD Anderson. One of the women that I worked with there actually worked in the lab. You know, we worked in the lab together. And she actually left the lab to take a job working in information technology for the nursing informatics department for the Harris County Houston Department of Health. They paid for her to become an RN. She went through a part-time program, got her ADN nursing, and then went on and did online and became an RN with a BSN. She does not work as a nurse at all. She really only did that because she knew that ultimately she wanted to be a leader in nursing informatics. Now, that might not be the path that everyone wants to take, but it's certainly, you know, to Odin's point, and I want to remind Odin that it's never too late. I'm just putting it out there. Med school, pharmacy, whatever. It's never too late. That you have the option to get the domain expertise by actually becoming a clinician, and it's not a bad idea to do it, because what I found is that a lot of positions, I'd say probably 75% of them are open to me. Now I'm about to finish a PhD, so that kind of takes it to another level. But that other 25% is only open to clinicians. So that's nursing, that's social workers, that any type of clinical degree. You'll find that if you have a clinical degree, you will be more open. You'll have more opportunities, to second Odin's point. And I'll just stop right there.
Thank you. Yeah. Also, think about your questions if you are coming in with just interest, so we can ask those too. But Andrea, what would you do? How would you start?
I personally wouldn't do anything differently. Let's see. Only thing I think I would personally do differently is maybe I would have taken more advanced math classes when I was in school, like linear algebra and like I don't know, just more math classes. Since if you want to grow in the field, you might have to take on more challenging technical problems. So just take as much math as you can, and I already had like a pretty strong foundation in statistics, so that's not an issue for me. But I think anyone that is going into the field should have like a strong foundation in statistics, and like that's like taking the class and learning like SPSS or SAS or whatever. Understand how to use the tool and like the actual coursework.
So you mentioned you wouldn't change much. So if you don't mind, could you kind of share what has worked for you, since it has mostly worked?
Well, I did a master's in epidemiology, which was very stats heavy, and we're required to like R and stats in school, and I think that's, and then I studied data science while I was in school too, so I pretty much learned everything while I was in school that I needed to know to get a job. So I think being in the master's program helps.
Okay, well, thank you all. So something we kind of touched on, but didn't get too much into. I think Auntie Kim did was kind of the tools and Odin, Excel. So with someone who has, so we talk a lot about entry into, but someone who has been in maybe a clinician or a nurse, they already have the domain knowledge and they have more, I don't know if it's time or room to learn anything that's not the domain. So if we were to lean a little bit technical, if I am a mid-career person, what can I do to boost my career? And this is kind of inspired by Kim's diagram. She has this really cool visualization she made about every job she had, how long it took to get there, the tools used. And yeah, so that's really my question. It's how would you bolster that side?
So if I understand the question correctly, this person is mid-career, they have the clinical knowledge, now they're trying to get to the next level. Did I get that correctly?
Yeah, clinical, it could be even social workers, like not necessarily nurses. But people who they're already really good at the domain. They just need the
Mhm.
other.
I would say, if I had to say one thing, it would be learning how to think like an analyst, learning how to conceptualize problems in an analytical way so you can get it ready for analysis. Um, uh, and what I mean by that is, let's say someone is a nurse in the ER, right? He or she has been doing this for a while, taking care of patients. Awesome. But how do you transition now into analytics? Well, using your foundation as an ER nurse, you can start to think about, okay, how much patients come in um, on a daily basis, different times a day. Do you see more foot traffic throughout the mid shift or the night shift? And then it's not so much just thinking about these questions. It's also then thinking, okay, well, what type of outcome? Because like Kim said, a lot of these things have to be tied to an outcome. So what outcomes can? Because as a nurse, you're very involved when it comes to patient outcomes. So it's more so framing that analytical mindset to be able to bridge that gap. I don't know if that makes any sense, but let me know if I need to clarify.
I think it does, but also I'm biased. I know what you're talking about. I'll pause if there's anyone who wants to ask a question based on what Odin said before we continue. Okay. Well, so
So, 1 second. So, someone actually sent me a DM because they weren't able to ask a question. And so I just want to say, if you have a question, there's an icon that you can use to just raise your hand, and then the host, Sia, will recognize you, and then she can make you a speaker. Just a FYI for anyone that wants to ask any additional questions. So the question, Sia, is that this person has been a data analyst for 10 years. There are lots of courses at their local community college in healthcare analytics, and they're interested in and not sure what classes or areas they should prioritize. So to answer the question, I actually posted the path that I took, the titles that I had. I think I shared it in a way that you should be able to access it. At any rate, if you go to my Twitter page and it's at Data Chemist, you'll see that I posted a graphic of where I started in 2012. Wow, 10 years. And it should bring you all the way up to I think my health data scientist position. I don't think that my current positions aren't there. I hadn't updated it that far yet. But that'll show you all the different courses that I took when I took them, the type of job titles that I had as I was moving along. And so that should be a good guide for you. But again, I think that if I'm speaking to someone clinical or even someone who's not clinical, but that you're a little intimidated by programming, I would say start with SPSS. And even though you may never use it again, it's just I think it's a really good confidence booster. At least what I actually heard. I only have a sample size of 1 for this. My sister friend, who's a PharmD, she took SPSS, and I think it really gave her a lot of confidence because I tried to show her Python, and she just was really overwhelmed, right? And I get that because that's how I felt too. So that's why I'm saying if you think you have some, some hesitations about learning the program, start with SPSS. With that said, there actually are a lot of healthcare organizations that use SPSS. Not a whole lot, but there are some. So to the person that had the question, if you take a look at that chart again, and to anyone else that wants to, feel free to do so. And if you have any additional questions, just let us know.
Thank you for the question. Yeah, so if you would like to speak up for your question, there is a request button on the bottom left side of your screen on the space. Dawn, I see you have a note or question. Welcome.
Hello, how you doing? Thank you for giving me the opportunity. Mine is not a question per se, but I just want to relate my story to this topic. Well, I did I had a background in health administration, and also I did a track in public health. And along the line, I started working as a case manager. So I know there's a lot of people trying to transition to the whole data analyst field, data science, and all that. So I think I'm a living example. So I want to just share my journey, how it started. So case management, I started working, and I knew about billing, so claims and all that. But I was doing that. I mean, the money wasn't enough, but I was also thinking, well, my background then I had my bachelor's in health administration, but I was doing my master's in public health. And I said, okay, by the time I finished my master's in public health, how would I transition into data analytics? I started doing my research, having a background in billing with claims and all that. What would be the best possible way to veer off into the analytics part? So I knew about SQL. I did a research about SQL. I started learning about SQL. And that's when the whole like self-learning kicked in. And then I think someone just mentioned 2012. Actually, as a matter of fact, that was exactly 2012. I knew about that. And I signed up to Udemy, started self-learning, and that's how I started. So from work, I was just practicing on the side. And before I knew it, I started doing a few things, building tables by myself while I was self-learning. And, started downloading, like I'll do like makeshift data for claims and more like a portfolio for myself, and that's how I started. So a couple of rejections later on, I was able to get a position as a health data analyst, and that's how I started. um, I got trained up using SAS, and right now currently learning how to use Python. So that was me. I know my mates who are into the public health field. I want to kind of transition into data analysis. This is what I'll tell you. Oftentimes it has to be self-learning as well. You have to, you know, um, you know, start doing the research because SQL. There's a whole lot of resources right now. Go on Udemy, go on Data Camp, go on YouTube if you can afford it. But it's like $10 on, you know, build a portfolio for yourself and practice and all that. Oftentimes people get scared, moving from one angle. So look at me from case management. I made my way into the data analysis part. It's possible. There are going to be a couple of rejections but eventually it will work out if that's your main goal. That's what you want to do. So I just want to drop it off there, trying to give those that drive people. I want to give people that motivation, that drive, and be like, you can do it because I did it. So it's really possible. Thank you.
Thank you, Don. It's always nice to hear from somebody who's done it all the way. So thank you. More stories is better because we're all different. The more we share, the more we touch more people. So thank you for that. No, I'm guessing your name is because of that image, which is really funny, but go ahead.
Hi everyone. I hope that y'all can hear me fine.
Yes,
Um,
we can.
I, I believe it was Kimberly who said that she had some familiarity with the Harris County health system. I actually live in Harris County. I was just wondering for all of you, actually, all of you professionals, how beneficial would you say taking a medical terminology course is in relation to a health data analytics career? Um, I'm always seeing whenever I'm looking at job postings in here in Texas that it's of the utmost importance, and I'm just wondering if that's another thing that's worth investing in, or maybe I should just focus more on the technical aspects. It might be a small question, forgive me, but I was just curious about what you host, O'Dane and Kimberly and Andrea, what you guys had to add to that.
So this is a great question. Before, Odin, I saw you unmute, but I just wanted to acknowledge, you said, I'm sorry if this is a small question. Please ask all the questions. Please never apologize for wanting to learn. And I will leave it to the speakers.
Thank you.
So if you look at the chart that everyone should be able to see, you see that one of the first courses I took was medical terminology. And I tell the story for people, I'm sorry if I'm boring you, but this is really important because ultimately, it was the issue of the lives of Black women living with HIV. I worked in a department as a senior data analyst for a major health system in Texas, where one of my colleagues was tasked with selecting women who had hysterectomy. I'm sorry, he was selecting women who, Black women living with HIV who needed to have cervical cancer screening. And in the process of analyzing his data, he eliminated all of the women that had had hysterectomies, not think that there are some types of hysterectomies where a woman can still have her cervix completely intact. And so the problem with that decision is that, it could ultimately affect someone's life. So when you take courses like medical terminology, I think I put on there anatomy and physiology, you learn those different things. And so that's a real good example of why if healthcare analytics is what you want to do, then you owe it to yourself and to ultimately the patients whose life your analysis is going to affect, to learn the lingo. So absolutely, medical terminology is a great first course, especially if you're just getting into the space and you're just kind of trying to, feel your way, see if you want to do it. If this is the area you want to specialize in, that's a great first choice. I would highly recommend it.
Thank you so much for your answer and for your time, everyone. I really ate it. And Kimberly, I just want to say that your work is super, super important. And not to say that all of you aren't, all of your work isn't, but your work is so important. And I look at you guys and I truly admire what you're doing, not just for Black women suffering with HIV, but for other marginalized groups such as, the LGBT community. And I mean, yeah, I can't sing you guys' praises enough, especially you. So thank you for your time. That was my only question, but yeah.
Thank you. Appreciate that.
Yeah, thank you. So any other questions before we move on? We're kind of going to switch gears and talk about marketability for a little bit and see why you should try and get into it if you are kind of hovering and not sure which domain of analytics to get into. So I'm going to pause again just for 2, maybe 10 seconds to see if we have questions before we move on. Okay. I just invited someone to speak because I saw your hand up, but I don't know if you were Modi, if you were intentionally asking or if you were just like clapping. So just let me. But so if Andrea, let's start with you, can talk to us a little bit about why health analytics? Why not tech or? And by the way, there's a lot of tech companies that are doing health angles, but why healthcare?
Hi. So for me, I've worked in healthcare pretty much since I started working. So it's just what I'm interested in is what I do. Like my mother's a nurse, and I just kind of got into healthcare really early and stuck with the field until now. So that's why I'm in healthcare. And I enjoy trying to find projects where I can health equity focus and try to improve health outcomes.
And if you were to not sell, because this is like the difference between being a pilot and I don't know what job where you can't have a bad day if you're a pilot, right? To what Kim was saying, some of the decisions of analysis are life and death, so you want to be careful. But beyond that very huge responsibility, why would you tell someone to join this career in this specific thing?
I think just if you want to make a difference in people's lives, but you just have to take it seriously.
And I would add that, and I posted a tweet about this, is that just like in tech, you don't have to code. In healthcare, you don't have to see patients. This is the type of people I tend to meet are those who are either clinicians that are just quite frankly burnt out and want to do something that, doesn't expose them to COVID, quite frankly, to put a fine point in it, or people who just don't like blood and didn't want to go to medical school, or maybe want to go to medical school and didn't become a physician for whatever reason. So for me, it's all about, like, I think Andrew's mother's a nurse, mine is too. My mother was a public health nurse to be exact, and actually worked as an epidemiologist for a brief while. So I guess you could say it's kind of genetic to, or runs in our families. I come from a family of nurses. And so, getting back through your career is kind of what we do. But for me, it's actually a little beyond that. I do specific research in health disparities. And what I realized probably the third or fourth year of working at a pharmaceutical company, hoping to discover the next big cancer drug, is that the next big cancer drug takes about 15 years. Whereas a lot of the work that I do in informatics can have immediate impact. That's that bench to bedside or translational informatics, meaning that you may often hear. So for me, it's about being able to make a real time difference in the lives of people who look like me.
Thank you. That's going kind of back to, I know it says no, but back to her point or their point about the impact made. Odin, which this is kind of a segue too, you can get into this, is you also started your career because your mom told you about informatics, right? And you just changed jobs a while ago. This is not all the things that Odin has mentioned in the previous space, so I'm not like saying his business. But can you talk about the subdomains and kind of industries that healthcare analytics can form into in the job market?
Sure. Before I jump to that one, I just wanted to add to the conversation in regards to why healthcare, and because a lot of these skills are transferable, you can go work at Google with the same skills. But I think in terms of, because a career is usually, let's say, between 35 to 45 years, depending on how you choose. And I always ask myself, do I want to help put the next phone in someone's hand, or do I want to help save someone's life? And it's for me, it's always been the saving the life aspect. I think when I communicate with a lot of my friends, they have a lot of negative stuff to say about healthcare, and rightly so. But I always ask myself, am I just going to add to the discord, or am I going to add solutions? And so for me, being in healthcare allows me to fix a lot of the issues that I myself have when I go for treatment or whatever the case may be. Um, I there was one I had one experience where I had went to a clinic, and I was just doing some I don't know if it was like blood or urine samples, and I was just observing how the person who was in the triage working with my samples, and I was just like, why is it being done that way? Like, it shouldn't be that way. Like, and I'm just here critiquing it, and I'm just like, well, in healthcare, that's process improvement. Like, how can I improve the process? And so that's my sort of like reason as to why healthcare. To talk about subdomains in healthcare, um, so I'm pretty early in my field, and so one of the things that I was trying to do is figure out the side of healthcare. Do I like being like do I want to be on the research side? Do I want to do clinical trials? Do I want to be in the hospital? Like, it's so broad. I started off in the hospital. I actually started off in the doing revenue cycle in the patient business, so dealing with insurance, and then from there I went to the finance department and learned about how claims are billed, and from there it wasn't really scratching the surface for me in terms of actually like having an impact. Then COVID happened, and I started to challenge myself more. How can you use what you know to really make an impact? And I think right now was probably a once in a career opportunity to have a big impact in the wake of a global pandemic. and so I made the switch to public health. Um, in terms of the subdomains, on the medical side, uh, caretakers, providers are charged with taking care of patients once they are already sick. I switched over to the side where I'm more interested in how can we make sure they don't become sick, because if they're already sick, a lot of the problems have already been done. So, um, with everything going on from predictive analytics to precision medicine and all these other good stuff, um, yeah, I made that switch to public health so I can be on the sort of like the preventative side of things.
Thanks. I'm really glad you went back to that because that was great. So where were we going with this? Oh, subdomains. Andrea and Kim, any additions?
Subdomains within health analytics.
Yeah. For example, when I was working last year, I was doing, Obamacare outreach. That's not necessarily directly clinical, but touches some portion of it. So like, there's all these different company impacts.
I guess for me, I'm like an epidemiologist, so I kind of combine like health analytics and data science and epidemiology when I can if the project requires it. So I guess that's a subdomain.
Okay. Dawn, I see your hand is up. Welcome back.
Yeah, can you hear me? Hello, can you hear me?
Yeah, we can hear you.
Okay, so just to add to what Dane said, I mean, one of the reasons why, for instance, me, what I do, when people ask me, what do I do? I tell them I use data to save life. There's something called the triple aim. So the triple aim is to improve the patient experience, lower costs, and better health for the population. I mean, as pretty much summarizes, what I do. So, what are better ways to improve, health for the members we serve? For instance, now I'm in the insurance part of it. I'm in the claims part of healthcare. So I always want to advise people who are trying to deviate or make their way into my field of focus. Kind of things I do. So I'm looking at the ED classification. So those who are going into ED, and at the same time looking at what are better ways to save cost, and also what are better ways to kind of reduce hospital beds. So these are things I do on a day-to-day basis. So lowering costs. Better health for the population. So to add to it, if people want to look into that area of claims, they can also like focus on that. Looking at the data, monitoring or doing a trend analysis. It's a day-to-day thing I do, and for me, I'm passionate about it. It's something people want to consider and want to go into that field as well. So I just wanted to add to it.
I'm actually gonna take what Don said add to it because I think he brings up a good point. A lot of There's a lot of subdomains here, and I think how you sort of like group it and summarize it all up is going back to that triple aim. And so for those who aren't too familiar with the triple aim, so in healthcare, the triple aim is the first one is how can we improve quality, and then the other one is how can we reduce cost. And then the third leg of that is how can we make your experience as a patient a good one? And so from those three aims now, there's so much different jobs under there. In terms of, let's say reducing cost. Well, you can work in a revenue cycle, you can work on a financial NL team, you can go into the actuaries, there's all these different other fields that are geared just to that aim in terms of improving quality. There's process improvement teams. There are quality assurance teams. There there are so much different teams, and I think you see where I'm going with this. There are so much different roles in healthcare aside from just nurses or doctors or radiologists. There are some really cool ones and some really um, ones there are ones that sort of like don't really get mentioned that much, but are equally as important. It's just a plethora. It's hard to break it into like group it into the subdomains. And I think the best attempt is, identifying those triple aims and looking at roles that are trying to solve those specific problems. Hey Modi, I see you have your hand up. Did you have a question?
Yeah, thank you for the great insight and you guys are giving me. I have a question. I'm from Kenya, like in Africa right now, and I'm working for the government as a health information management officer. But I feel like I'm we're just using one system called, and I don't know if you guys are familiar with it. It's called Kenya Health Information. Sorry, DHIS, District Health Information System. So I don't feel like it has really good impact, or it's very good in analysis. So I would love to ask you guys which programming language is really good. Someone who's interested in venturing into the private sector and work for these big companies in the health sector. Yeah, that's my question. Thank you.
I would recommend using R 'cause it's free, and a lot of companies use it, and there's lots of open source packages and everything. So that would be my suggestion.
Yeah, I used to be now I'm gonna admit, I know this is a recorded session, but I'm going to admit that in terms of the R and Python debate, uh I chose the Python side even though I don't even know how to program in Python. And I think that's a lot of people's story as well, right? They side with the language and sometimes they don't know what the language is. But to answer your question, it really all just depends on the team that you're on. On my previous team, we used SAS and SQL, and that was when I was on the finance slash insurance side of stuff. Currently now I work for the government, and they seem to be pretty open when it comes to tools. It's really just whatever you're comfortable with. They have it all: Tableau, Power BI, R, Python, SAS, SQL. So I hope that helps in a little bit. So to summarize, you're gonna have the ones that your team uses, and that's probably gonna be the one that you'll have to use if you're on that team. But then also you can land on a team that is just tool agnostic and it's just whatever gets the job done and whatever you're comfortable with. Um, and that's usually what I see companies doing.
So also to add to it, I know you did mention you work for the health, is this something like the health department in Kenya? Again, it also has to do with the flow of data you're receiving. I mean, like they said, the right tools to use, Python, Arrow, and all that. Again, um, it depends on how large your data is. You can also say, okay, you want to visualize that. You can put, use an Excel file and put that on Tableau. Well, I don't know the BI tool, but for me, instance, I use Tableau right now. You can just go. You can just do you don't even really have to do data manipulation and all that. You can just put an Excel file, upload it into Tableau, and visualize what you need to visualize. Again, like I said, it depends on how large your data is, and how clean the data is. If you have to do like the data cleaning and all that, then now you have to think about a bigger tool to use. Now that's when SQL comes in. That's when Python comes in for automation, or maybe you want to use R. So the first thing, you always want to look at is how large the data is. So now, like in healthcare, we're going into big data. Why? Because now the data is becoming way bigger. What SQL used to do is not what it's doing these days, because we have a large data is coming from, for instance, in America. Like we do claims, we do insurance and all that. So going back to your country, you have to narrow it down to the flow of data. How much data comes in. If it's large data, then now you start thinking about the tools at hand. Okay, I'm going to use SQL. Maybe I'm going to use Python for better automation. Or maybe if it's just a small data, then I have to go the BI route, which in most cases it works hand in hand. For instance, where I work at right now, I backend is SQL. Then I have to create that meaningful insight for the stakeholders who don't really know how the data is being pulled. I have to visualize that using Tableau. So these are kind of things you have to put into consideration. The flow of data. If it's a smaller data, then you put that in Excel, visualize that. So that's my 2 cents.
Yeah, Don, I totally agree. It all depends on, I think it's the three V's, the volume, velocity, how quickly, how often is that data flowing through, how large is it, and what type of value can you get from it? That's going to really decide on the tool. Like if I'm working with a table that's, let's say, 100 rows, I'll probably just throw that into Excel because Excel can handle that really quickly. But as the volume goes up, the tool is going to change. And so, yeah, good insights, Don. I totally agree. So the next topic that we want to segue into is different salaries in different industries. So whether that be the federal government, industry, academia. Um, I'll see if Andrea wants to touch that one, and then I can add to it. I'll start it off, and then Andrea can come in a little bit. So you have your three industries. You have academia, you have industry, whether that be, a hospital that you're working with, and then you have government. I haven't worked in academia, so I can't speak to what type of salaries are in academia. From what I've gathered from different Twitter posts, it doesn't seem like a lot of people are very happy in academia. So take that with a grain of salt. In industry, it really just depends on how much experience you have and also the company. But I think the biggest factor is location. So you might be a health data analyst on the East Coast, but don't expect like a $200,000 salary if you're based in, let's say, Aaliyah, Florida. Where you're based is definitely gonna come into play, and also how much years of experience you have. I would say for entry level, reasonable for an entry level health data analyst, it's probably going to be around, if I would say if you have a bachelor's degree, I would say between 55 and 65,000. That's a pretty reasonable entry level starting point. If you have your master's, that's when you start getting into, let's say, 65, 75, and then it just goes up from there. On the government side of things, it all depends on your negotiation skill. I mean, for all of these industries, it depends on your negotiation skills. And again, it just depends on where you live, whether that be the East Coast, West Coast. So that all depends. I'm based in Florida, and I've been told that the working for the government in Florida doesn't pay well, but I work for the government on the West Coast. So I work for the state of Washington. So I understand that my salary range isn't what normal people in my field would make in Florida, for example. So like I said, it just all depends from location. I would definitely say the scales are in demand. So you can definitely touch six figures. But yeah, it all depends on you as a person, I think.
Hello. I would say the same thing for the most part. I used to work in it for a very long time, at least 10 years, and several different data positions. Did not pay great, but I did enjoy the experience because I got lots of learning, lots of domain knowledge during that time. But yeah, the pay, I would say expect to start around probably 50 or 60, but if you're in academia, you might start as low as like 40, depending on where you are. So but it's a good place to build your skill set and just use the university resources to skill up while you can. And then I've worked in government too. The pay there is better. I'm guessing as like a data analyst, you probably could make closer to like 70 or 80,000. And then if you go into the private sector, then there's more salary to growth once you leave academia and the government sector.
So the next question I want to ask is, how long did it take to get into into the position that you're currently in? Andrea, did you want to start with that one?
I honestly, my current position, I wasn't really even looking for the position. So, but to just become a data scientist, I didn't really start thinking about it until like, let's say maybe 2016, 2017. And I got my first position, gosh, when did the pandemic start? 2020 and in 2020.
It's actually funny because like Andrea said, um, it kind of just happened. I had a conversation with Andrea when we were recording a podcast, and I was asking her about epidemiology. And after recording that podcast, I was like, huh, that field sounds exciting. And I applied, and 2 weeks later, I was in the field. So it really just shows how quickly things can change. So in terms of how long it took me to get to this point, I would say, you know, uh, I graduated high school in 2012 and had to do, what's that, 8 years of, just trying to figure out life. But once I graduated with my master's was really when things started to pick, and I graduated with my master's in 2020. So I would say roughly 2 years was how long it took to get into the field for me. Hey, Hannah, I see that you have your hand up.
Hi, so I currently work in global health as a data analyst. It and it took me a really long time. So global health is one of those fields where they really do prefer that you have like a master's degree. So for me personally, right after graduating undergrad, it took me many years to kind of break in, and then I actually went back to school to get my master's degree, and then from there, things kind of picked up for me after I focused on health systems, and after that, I got an internship with USAID, and then yeah, just like currently working in the global health space as a data analyst. So I would say it also does depend on like where you go. I think um, certain fields are require a lot more work and time, and you may have to accept internships or positions you don't like as much. But I do think coming from a data perspective, once you have those technical skills, it definitely does give you the space to grow quickly. And I started off slow because I didn't have those skills as much. I was more focused on global health work. And as I started to pick up more technical skills, I definitely saw myself kind of catapulting to the next level a lot more quickly.
Thank you for sharing, Hannah. My minor was in global health, and honestly, when I had got my minor in global health, I didn't realize how quickly I was gonna have to use knowledge that I learned when I was pursuing that minor. But yeah, what a time to have a global health background. I think, like I said earlier, this is like the once in a career life opportunity to really put a lot of those skills to work. At this time, I want to go ahead and I want to open up the floor to the audience. If you guys have any questions for Andrea and I, we can take that. Have your master's, that's when you start getting into, let's say, 65, 75, and then it just goes up from there. On the government side of things, it all depends on your negotiation skill. I mean, for all of these industries, it depends on your negotiation skills. And again, it just depends on where you live, whether that be the East Coast, West Coast. So that all depends. I'm based in Florida, and I've been told that the working for the government in Florida doesn't pay well, but I work for the government on the West Coast. So I work for the state of Washington. So I understand that my salary range isn't what normal people in my field would make in Florida, for example. So like I said, it just all depends from location. I would definitely say the scales are in demand. So you can definitely touch six figures. But yeah, it all depends on you as a person, I think.
Hello. I would say the same thing for the most part. I used to work in for a very long time, at least 10 years, and several different data positions. Did not pay great, but I did enjoy the experience because I got to lots of learning, lots of domain knowledge during that time. But yeah, the pay I would say expect to start around probably 50 or 60. But if you're in academia, you might start as low as like 40, depending on where you are. So, but it's a good place to build your skill set and just use the university resources to scale up while you can. And then I've worked in government too. The pay there is better. I'm guessing as like a data analyst, you probably could make closer to like 70 or 80,000. And then if you go into the private sector, then there's more salary to growth once you leave academia and the government sector.
So the next question I want to ask is, how long did it take to get into into the position that you're currently in? Andrea, did you want to start with that one?
I honestly, my current position, I wasn't really even looking for the position. So, but to just become a data scientist, I didn't really start thinking about it until like, let's say maybe 2016, 2017. And I got my first position, when did the pandemic start? 2020 and in 2020.
It's actually funny because like Andrea said, it kind of just happened. I had a conversation with Andrea when we were recording a podcast, and I was asking her about epidemiology. And after recording that podcast, I was like, huh, that field sounds exciting. And I applied, and 2 weeks later, I was in the field. So it really just shows how quickly things can change. So in terms of how long it took me to get to this point, I would say, you know, uh, I graduated high school in 2012 and had to do, what's that, 8 years of, just trying to figure out life. But once I graduated with my master's was really when things started to pick, and I graduated with my master's in 2020. So I would say roughly 2 years was how long it took to get into the field for me. Hey, Hannah, I see that you have your hand up.
Hi, so I currently work in global health as a data analyst. It and it took me a really long time. So global health is one of those fields where they really do prefer that you have like a master's degree. So for me personally, right after graduating undergrad, it took me many years to kind of break in, and then I actually went back to school to get my master's degree, and then from there, things kind of picked up for me after I focused on health systems, and after that, I got an internship with USAID, and then yeah, just like currently working in the global health space as a data analyst. So I would say it also does depend on like where you go. I think um, certain fields are require a lot more work and time, and you may have to accept internships or positions you don't like as much. But I do think coming from a data perspective, once you have those technical skills, it definitely does give you the space to grow quickly. And I started off slow because I didn't have those skills as much. I was more focused on global health work. And as I started to pick up more technical skills, I definitely saw myself kind of catapulting to the next level a lot more quickly.
Thank you for sharing, Hannah. My minor was in global health, and honestly, when I had got my minor in global health, I didn't realize how quickly I was gonna have to use knowledge that I learned when I was pursuing that minor. But yeah, what a time to have a global health background. I think, like I said earlier, this is like the once in a career life opportunity to really put a lot of those skills to work. At this time, I want to go ahead and I want to open up the floor to the audience. If you guys have any questions for Andrea and I, we can take those now. So in the absence of questions, I definitely want to thank you guys for tuning in for part 2 of this health data analytics career Twitter space. We are having a networking event later on this month. So definitely keep an eye out for that date once we have it together. Yeah, definitely thank you guys for coming. If you guys have any questions for either Andrea and I or Kim, feel free to reach out to us. And definitely stay tuned for more events from Black Tides.